Today, I want to sit with you, like an old friend, and talk about something vital: 5 common medical tests that, if you're over 70, you might want to think twice about. I think of my neighbor Margaret, a sprightly 78-year-old with a laugh that could light up a room. She'd tell me about her garden, her roses, and the way she danced at her wedding 50 years ago. Margaret went for a routine screening, a PSA test for prostate cancer, recommended by her doctor just to be safe. Her husband Tom had passed from cancer years ago, so she was vigilant. The test came back elevated, and suddenly, her world spiraled into biopsies, consultations, and sleepless nights. The PSA test for prostate cancer, often pushed as a must-do for men over 70. The prostate-specific antigen test measures a protein in the blood, and high levels can suggest cancer. As men age, the prostate naturally enlarges, and PSA levels often rise without cancer being present. Studies, like those from the U.S. Preventive Services Task Force, show that for men over 70, routine PSA screening often leads to false positives, results that screen danger when there's none. These false alarms trigger biopsies, surgeries, even radiation, which can leave men with incontinence, impotence, or infections. Imagine a man like George, 74, who loves his morning walks with his dog, Rusty. A high PSA leads to a biopsy, and suddenly, he's in pain, avoiding his walks, feeling less like himself. The truth? Prostate cancer in older men often grows so slowly it's not a threat in their lifetime. The test might find something, but treating it could steal more from your quality of life than the disease itself. If you're over 70, talk to your doctor about whether this test is truly necessary for you, especially if you have no symptoms. Breast cancer screening feels like a lifeline, and for good reason. It's saved countless lives. But for women over 75, the story gets murkier. I think of Clara, a 76-year-old who knitted blankets for her grandkids and loved her book club. Her doctor insisted on yearly mammograms, but one flagged a suspicious spot. What followed was a whirlwind: biopsies, anxiety, and a diagnosis of ductal carcinoma in situ, a non-invasive condition that might never have caused harm. Claire endured surgery, radiation, and months of recovery, only to wonder if it was worth it. Research, like a 2014 study in the Journal of the National Cancer Institute, suggests that for women over 75, routine mammograms often detect slow-growing cancers that won't impact life expectancy. Yet, the treatment: surgery, radiation, chemotherapy can cause pain, fatigue, even heart issues. If you're in your late 70s or beyond, ask your doctor, is this test about prevention, or could it lead to more harm than good? They're the gold standard for catching colorectal cancer, and no one disputes their value for younger adults. But for those over 75, the risks start to outweigh the benefits. I remember my Uncle Frank, 80, who loved his weekly card games and telling stories about his Navy days. His doctor recommended a colonoscopy just in case. The prep days of fasting and harsh laxatives left him weak and dehydrated. During the procedure, there was a complication: a small perforation in his colon, and Frank ended up in the hospital for weeks. The cancer they were looking for? It wasn't there. Studies, like those from the American College of Physicians, show that for people over 75, especially those with health issues like heart disease or diabetes, colonoscopies carry higher risks: bleeding, perforation, even heart strain from sedation. Colorectal cancer often grows slowly in seniors, and the prep and procedure can be brutal on an aging body. If you're over 75, consider whether less invasive options, like stool tests, might be enough to keep you safe without the ordeal. Bone density scans for osteoporosis. These tests use low-dose X-rays to measure bone strength, and they're often recommended for women over 65 and men over 70. Sounds harmless, right? But here's where it gets tricky. For seniors over 75, especially those with other health conditions, a bone density scan can set off a cascade of interventions that don't always help. Take Evelyn, 79, who loved her weekly yoga class. Her scan showed mild bone loss, and her doctor prescribed bisphosphonates drugs to strengthen bones. But Evelyn soon dealt with side effects: jaw pain, digestive issues, and a rare but serious risk of fractures from the medication itself. Research from the New England Journal of Medicine suggests that for many seniors, especially those over 80, treating mild bone loss doesn't reduce fracture risk enough to justify the drug side effects. Lifestyle changes like gentle exercise, calcium, and vitamin D can often do more good with less harm. Finally, let's touch on stress tests for heart disease. These tests, often involving a treadmill or chemical injections to mimic exercise, check how your heart handles stress. They're common for seniors, especially those with chest pain or heart history. But for those over 70 with no symptoms, routine stress tests can be a Pandora's box. I think of Henry, 82, who loved fishing with his grandson. A routine stress test showed an abnormality, leading to angiograms and stents. The procedures left him weaker, and the medications gave him dizzy spells. Worst of all, the heart issue might never have caused problems in his lifetime. Studies, like those from the American Heart Association, show that for seniors without symptoms, stress tests often lead to unnecessary procedures, stents, bypasses that carry risks like bleeding or stroke. For someone in their 80s, the focus should be on managing blood pressure, cholesterol, and lifestyle, not chasing shadows with invasive tests. As we weave through these stories, Margaret, Clara, Frank, Evelyn, Henry, we see a pattern. Aging brings wisdom, resilience, but also vulnerability. Medical tests sold as safety nets can sometimes unravel the very life you're trying to protect. The truth is, seniors face unique challenges, bodies that tire faster, hearts that carry decades of love and loss, and a healthcare system that sometimes forgets the human behind the chart. Ignored symptoms like fatigue or mild pain can be brushed off as just aging, while unnecessary treatments can rob you of energy, independence, even joy. Every test, every pill, every procedure comes with a cost not just to your wallet, but to your spirit. I want you to imagine something. Close your eyes for a second and picture yourself 5 years from now. Maybe you're laughing with your grandkids, tending to your garden, or just sitting quietly, feeling at peace. That's the life we're fighting for, not a life of endless appointments or fear, but one where you feel strong, valued, and heard. Aging isn't about defying time. It's about embracing it with grace. That means saying no to tests that don't serve you and yes to what does. Walks in the fresh air, meals shared with loved ones, moments that make your heart sing. Talk to your family, your doctor, your friends. Make decisions that honor your body and your story. Friends, if this resonates with you, if you want to keep learning how to protect your health, live longer, and feel truly cared for, please consider subscribing to our channel. We're here to share truthful, science-based, and compassionate insights about senior health, longevity, and the beauty of aging. Every week, we dive into stories and advice to help you and your loved ones thrive. Hit that subscribe button, and let's walk this journey together. Your life, your health, your happiness, they matter, and we're here to help you protect them.